Welcome to this explainer. I am so glad you're joining us today because we're unpacking something genuinely massive. For decades, health and social care has kind of been defined by fragmentation, right? Siloed budgets, competing departments, and patients inevitably slipping through the cracks. But we aren't here to dwell on the problems today. Instead, we're focusing on the immense potential of a strategy based entirely on alignment. We're going to see what happens when giant, complex bureaucracies finally stop pulling in opposite directions and just row the exact same boat. Let's get right into it. I want to pose this question directly to you, right out of the gate. What actually happens when three major, historically separate health agendas finally point in the exact same direction? Seriously, think about that for a second. Imagine the total absence of that typical bureaucratic red tape. Instead of the usual friction where local, regional, and national departments are all fighting over competing priorities, what is the incredible potential of genuine, unified alignment? Honestly, it's a total game changer. Okay, here's our roadmap for today. 1. The power of alignment. 2. Where the strategies overlap. 3. Putting the citizen first. 4. Neighborhood teams in action. 5. National and digital foundations. And finally, 6. A sustainable care future. Let's dive right in.
Section 1. The power of alignment. 3 plans, 1 vision. We are looking at a truly historic convergence of policy here.
So let's look at the specific pillars holding this whole thing up. We're talking about 3 distinct strategies setting a shared direction for the future of care. First up, you've got Andy Burnham's outline for social care, which really tackles our historically underfunded and, frankly, disjointed social support system. Second is the NHS 10-year plan, which is essentially steering the massive ship that is our national healthcare system. And third, the National Neighbourhood Health Framework, which is all about local, on-the-ground action. Now, individually, any one of these is a robust piece of policy. But together, they form this formidable national foundation that literally changes the landscape of how care is delivered. When you combine those 3 pillars, they point to this one massive opportunity, captured perfectly right here, a national care service delivered through neighborhoods. What does that actually feel like for a patient? Well, it means the care comes directly to you. It means a system that's person-centered, preventative, and digitally enabled, delivered by integrated teams right where you live, rather than forcing you to travel to some distant, overwhelming institution. Moving on to Section 2, where the strategies overlap, the convergence. Let's see exactly how these 3 distinct plans merge into one single super strategy. Notice the alignment strength here. It's very strong across the absolute board. We aren't just talking about some vague, high-level agreement on principles. Take home and community first, for instance. Historically, funding heavily favored big hospitals. Now, all 3 of these strategies violently agree that the home is the best place for care. Or look at prevention and early intervention. It is notoriously hard to get funding to prevent something that hasn't even happened yet, but here the alignment is ironclad. Whether the goal is putting the person at the center or reducing hospital admissions, these agendas are an absolute lockstep.
The crucial point is that this alignment forces a complete paradigm shift. We're moving away from that old analog model where you basically wait until you're profoundly sick and then you're sent to a sterile, overwhelmed hospital for treatment. I mean, it's kind of like waiting for your house to catch fire before you even think about installing a smoke detector. The new, aligned vision is digital by design. It's heavily focused on proactive prevention and anchored right in the home and community. It's about regular maintenance, catching the sparks before there's ever a fire.
And diving into the granular details, this isn't just broad agreement. This matrix maps out shared outcomes for health and social care integration, local government partnerships, and, crucially, workforce reform. It's a completely joined-up approach. Let's just trace one of those threads, workforce. When Burnham's call for better pay and career progression aligns perfectly with the NHS 10-year plan for workforce transformation, and then that is supported by the multidisciplinary models in the neighborhood framework, you don't just get happier staff. You get lower turnover, less burnout, and ultimately, vastly better care for the patient. The strategic alignment at the very top dictates the quality of care on the ground. Section 3. Putting the citizen first. The zoom out begins. We've talked quite a bit about high-level policy, but let's shift gears and look at what this actually means for a real human being navigating the system. Let's see how this builds, kind of like a ripple effect, creating a completely connected system. There are 5 distinct levels here. It all starts right at the center, level 1, with the citizen. Surrounding them in the second ring are the neighborhood health teams. Then zoom out to level 3, and you have the National Care Service and the NHS, collaborating to support those teams.
Level 4 provides the invisible digital foundations enabling all that communication. And finally, Level 5, the outermost ring, is that overarching national policy foundation we just discussed, which keeps the whole ecosystem stable.
The absolute unwavering mantra of all this alignment is right here. The right care in the right place at the right time. Let that sink in for a second. Every single part of this complex structural shift exists to guarantee this one outcome. Let's focus right at the top on the citizen, the stick figure at the absolute heart of everything, because this represents what really matters to people. Imagine an elderly person who desperately wants to maintain their dignity and independence by staying in their own home rather than moving to a residential facility. For them, choice and control means actually having a say in when their carer visits or having proper support systems in place for their family members who help out. This entire massive policy alignment is engineered specifically to serve this individual's personal, deeply human goals. Okay, Section 4, Neighborhood Teams in Action, Local Delivery. Let's look at how this aligned care is actually delivered on your own street. We've all heard those incredibly frustrating stories of a vulnerable patient having to repeat their medical history like 5 different times to 5 disconnected agencies just to get a little bit of help. Well, this aligned strategy eliminates that by surrounding the citizen with one proactive, multidisciplinary team. Just picture a GP, a community nurse, a mental health practitioner, and a local housing partner all sitting together, sharing the exact same goals for that one patient. It means rapid response to avoid crises, early interventions before things get bad, and completely joined-up care, all because the team isn't trapped in silos anymore.
Section 5. National and Digital Foundations. The enablers. To make those local teams work, we need some serious scaffolding operating behind the scenes.
Historically, there has been massive friction between social care and the NHS. Different budgets, different rules, different management. But here, they are working hand in hand. Because of the policy alignment we talked about, they now share a single purpose: helping people live independently. They share a workforce model, they share standards for consistent quality, and they share outcomes focused on reducing inequalities. By bridging this gap and securing sustainable funding, the system literally stops fighting itself. It saves money, it reduces delays in getting patients out of hospital, and most importantly, it saves lives. They are integrated nationally, so they can deliver locally. And underpinning all of that is the digital foundation. We've all experienced the sheer frustration of our medical records not transferring between one doctor and another. While a digital by design approach is the invisible glue fixing this. It means one joined-up, shared care record per person, so teams aren't just guessing in an emergency. It empowers patients with easy access via the NHS app. It utilizes population data to predict community needs before they spike, and leverages AI for decision support, all wrapped up in robust cybersecurity. It securely connects the people, the teams, and the information. Which brings us to Section 6, a sustainable care future, shared outcomes. Let's take a look at the ultimate destination of this massive strategic alignment. This right here is the true potential of a strategy based on alignment. It is not just bureaucratic shuffling. It's about tangible, life-changing outcomes. Because these massive agencies are finally pointing in the exact same direction, people actually get to live independently in their own homes for longer. We experience fewer agonizing crises and avoidable hospital admissions. We get a workforce that finally feels valued, skilled, and supported. And ultimately, we achieve a sustainable health and care system that isn't constantly teetering on the brink of collapse. Better lives, stronger communities. That is exactly what happens when strategy aligns with human needs. So, I want to leave you with a rather heavy question to ponder today. Think about the people you know and the care they receive. How could a fully aligned, community-based care system completely transform your own neighborhood? The blueprint is here. The alignment is happening, but the execution is going to define our future. Thanks for joining this explainer, and keep asking the big questions about your community's care.